The main chemical and environmental intolerances most frequently reported by patients with MCS are household cleaning products, bleach, detergents, window cleaners, shoe polish, and personal care and hygiene products. Colognes are striking. They're particularly striking. As doctors in environmental medicine visiting patients, we try not to wear cologne or use fragrant deodorants, soaps, gels, shampoos, or cosmetics. Large indoor surfaces can overwhelm them. Air fresheners, candle smoke, and printer ink, like grocery receipts, is an endocrine disruptor. In interior spaces, since large surfaces are quite dizzying, they are devastating for them. Air fresheners, candle smoke, ink from newspapers or magazines, and watch out for printer ink, like the ink on receipts from a regular purchase, even if it's from the grocery store. That ink is an endocrine disruptor. On public roads, gasoline, exhaust fumes, solvents, and paints. And the fumes, they are particularly intolerant to fumes. This is important. What diseases are included in central sensitization syndromes? It's not just multiple chemical sensitivity. We also have electromagnetic hypersensitivity. It's a subjective clinical process characterized by recurrent and non-specific symptoms attributed to exposure to electromagnetic fields from mobile phones, laptops, desktop computers, even televisions, Wi-Fi, and Bluetooth. 1. Prevalence of up to 3. Chronic fatigue syndrome. This is usually a somewhat more advanced stage. Patients diagnosed with fibromyalgia usually start experiencing symptoms and then progress to chronic fatigue, meaning the body kind of wears out. There's an intolerance to physical exertion that has been developing over a long time, affecting many systems in the body. Patients lose their ability to carry out daily activities. Fibromyalgia, which is widespread musculoskeletal pain accompanied by fatigue, sleep problems, memory issues, and low mood. Acoustic hypersensitivity, hyperacusis, or oligoacusis. Hearing loss can be a central sensitivity syndrome. And here we have other conditions like chronic irritative or interstitial cystitis, non-traumatic dysfunction of the temporomandibular joint, multiple endocrine disruption, myofascial pain, migraine, and other vascular headaches. Restless leg syndrome, very important. A lot of people have it and they don't know where it comes from. Irritable bowel syndrome, dry mucosa syndrome, also known as Sjogren's syndrome. You can find this graph in the Navarra document where it mentions chronic fatigue syndrome, electromagnetic hypersensitivity, fibromyalgia, and multiple chemical sensitivity. And here, just a little teaser I'm giving you for when you have the class with Mar Alonso. The disease of amalgams, which is having a mouthful of fillings that release mercury throughout life, day and night, can be one of the triggers for these central sensitivity syndromes. I repeat, because it's important for us to have this image in our heads of what central sensitization syndromes are and the patients who may be diagnosed by different specialists. I repeat, irritable bowel syndrome. Many patients with headaches are diagnosed with tension headaches and go to the cardiologist to get prescribed an antihypertensive. Then they see the neurologist, who usually starts them on mild painkillers and then moves up from mild to antidepressants. And eventually we end up with stronger medications like Atalanta, Tramadol, and morphine derivatives. 1,000 disorders of the temporomandibular joint, myofascial pain syndrome, soft tissue pain syndrome. All of this is typical of a patient with fibromyalgia, restless leg syndrome, multiple chemical sensitivity, female urethral syndrome, interstitial cystitis, traumatic stress syndrome, fibromyalgia, and chronic fatigue. It's all a mix of unspecific syndromes. These are patients who go from doctor to doctor, from specialist to specialist. They sometimes become a sort of hot potato. Nobody wants to take them on. And in the end, everyone ends up sending them to psychological help because modern doctors aren't prepared to understand this yet, and we're still working on it. The deterioration in the quality of life for these people is such that they may end up leaving their jobs, experiencing a noticeable physical functional decline, and having difficulties socializing, with no chance to enjoy leisure activities, free time, etc. I do online consultations, particularly with Finland, since my wife is Finnish, and I can tell you that in a country like Finland, with 6 months of winter darkness, with temperatures of 20 to 30 degrees, and a country roughly the size of Spain, with a population of just over 5 million, there are people who are left alone in a house where they can barely move. Their families also struggle to cope with someone who can't, well, anything really. They can't use soap, they can't use shampoo, they can't use cologne, and all foods upset their stomach. These are cases that are usually isolated, and they also don't seek medical attention easily because going to a hospital is devastating for them. The electromagnetic load, smells, the treatment in an emergency service, well, all of that repels them. So, to assess the quality of life of these patients, which is useful both for diagnosis and for evaluating therapeutic measures, there are several questionnaires, the short form health survey, questionnaires like the congruity, life satisfaction measure. All of these are quality of life questionnaires. And the KESI questionnaire, which we'll look at in detail later, I'm going to give you an assignment. I've put the English version, but just so you have to look for the KESI questionnaire, you're going to search for it in Spanish yourselves. It's translated, and each of you will try to find it and see that it's actually a very useful questionnaire to use with these types of patients, which also includes a section. This questionnaire for assessing quality of life isn't something new. Look, the Community of Madrid has a protocol for emergencies. For the emergency units, a protocol for chemical sensitivity. And it states that special care is needed for these patients. Put up signs identifying multiple chemical sensitivity. Pay special attention to the following symptoms that may occur as a reaction to exposure to various chemicals: headache, sinus, fatigue, extreme weakness, difficulty breathing, chest pain, etc. Let the patient know that the staff attending to them is knowledgeable and understands MCS, multiple chemical sensitivity, and suggests alternative products instead of alcohol, hydrogen peroxide or povidone 2001. Instead of plastic intravenous cannulas, use metal butterfly needles. We already know why plastic use adhesive tape instead, paper tape, instead of dextrose, saline, or ringers. This is basically because they come in glass bottles. Don't use plastic containers and always give water in glass bottles. This is in place and there's the regulation, but what's missing is the usual knowledge so that these people can be treated properly without triggering problems. It may seem exaggerated at times, but there are people who can have a seizure just from a perfume, from a strong cologne, someone walking by with a strong cologne, and the patient can have a seizure that seems unreal. It's not a conversion syndrome, nor are they making it up. And the same thing happens with food. There are many cases where certain foods cause mood changes, behavior changes. There's a case that Dr. Pilar Muñoz Calero shared with us in class about a girl who would turn into a real demon every time she ate food she was sensitive to, and nobody knew what was happening to her. The girl would lose control, and her family didn't know what to do with her until they realized that every time she had a certain dish, she would have that reaction. This is another one of the questionnaires to assess the scales of intolerances to different things, like noise, special sensitivity to noise. We tend to blame it on them, like, this is really strange, this person has noise intolerance, this one fights with the neighbors because they won't let him sleep. So for that, we have a questionnaire with no less than 21 questions to objectively see if that patient really has a problem, an exaggerated sensitivity to noise. And this is the questionnaire, the Quick Environmental Exposure and Sensitivity Inventory. Look it up in Spanish. It has a quick interpretation once you've filled out the questionnaire, as per the symptoms, a quick overview. If the symptoms are in the head, cognitive, affective, neuromuscular, musculoskeletal, skin, genitourinary tract, gastrointestinal tract, chest, and it looks at symptoms before and after exposure. It has quick interpretation method once you've filled out the questionnaire, because depending on the symptoms, you have this quick overview. It depends on whether the symptoms are related to the head, cognitive, affective, neuromuscular, musculoskeletal, skin, genitourinary tract, gastrointestinal tract, chest or heart or airways. And before the exposure event, after the exposure, I haven't gone into detail on many things today because we would run out of class time. Sometimes it's much better when you study them on your own. I believe there are things that need to be let go during the class, but then the student should feel the need to go and research it and understand it on their own, because that's how it really sticks and how you learn. This is an example of the questions on a scale from 0 to 10. The patient is asked to talk about their responses to a variety of substances, a specific exposure like tap water, certain foods like sweets, pizza, milk, fatty foods, barbecued meats, onions, garlic, and so on. Do I feel sick after meals? Do I feel sick if I drink or eat less than usual? Then we'll see why these questions are asked. It's a really nice questionnaire. It's very well designed, and I truly invite you to look into it. So to summarize, we can go to the characteristics of Cullen's syndrome, which has 7 criteria. It's an acquired disorder related to exposures, insults, or documented environmental illnesses. The symptoms involve more than one organ system. This is important. It limits attention to those affected with very complex symptoms. The symptoms come and go in response to predictable triggers. This excludes patients whose symptoms remain constant, without variation, or that are largely unrelated to exposures. The symptoms are triggered by exposure to chemicals of different structural classes and toxicological modes of action. This distinguishes them from allergic reactions that are triggered by specific substances. Then we'll look at this in a bit more detail. The symptoms are triggered by exposures that are demonstrable, although at low levels. As I told you, the majority of the population doesn't develop symptoms at those doses. It means that those other people are able to perceive the presence of the substance, for example, by the smell, even though it doesn't cause them any discomfort. CC by Antarctica Films, Argentina. The exposures that trigger the symptoms have to be very low. We're not talking about direct toxicological damage from an overdose. We're talking about low doses because the patient is sensitive to that. There is no functional organic test that can explain the symptoms. It's hard to quantify. This characteristic excludes individuals whose symptoms can be attributed to bronchospasm or vasospasm, USAND or any other injury or reversible condition that can be specifically diagnosed and treated. So, there are questionnaires available that I recommend you check out as support for the diagnosis. The ones we looked at before include the Weinstein Noise Sensitivity Scale, the Perceived Stress Scale, the Odor Susceptibility Scale, the University of Toronto Health Questionnaire, and the IEC, which is, let's say, the version prior to the QSE. We really have to use the KESI that's here, which we've already looked at briefly, and it has some diagnostic criteria. That's for the diagnosis. If we want to assess the quality of life and see if we're getting the treatment right for the patient, and if it's going well or not, then we have this number of questionnaires. They help estimate the satisfaction with quality of life, and the same one is a section to assess this quality of life.